Shall I share my screen?
Yes, ma'am. Please go ahead.
Let me know if you all can see. Can you see my screen?
Not yet, ma'am. Yes, ma'am. It's coming through.
Now can you see?
Yes, ma'am. Yes, ma'am.
Okay. Yeah. So I'll start.
Sure, ma'am. Please go ahead.
Ma'am, good morning, ma'am. Can I introduce yourself, ma'am?
Yeah, please.
Good morning, everyone. Am I audible?
Yes, please go ahead.
Yes. Myself, Azi Bhuvana, studying Pharmacy 5th year in Ratnam Institute of Pharmacy, Nellore. It's an honor and privilege to introduce the eminent speakers for today's session, Tanushree Chowdhury ma'am and Dr. Navyashri. Firstly, I'm going to introduce the dynamic and energetic woman, Tanushree ma'am. Tanushree ma'am has completed her master's in Hospital and Health Information Management from Manipal College of Allied Health Science, Manipal University. She has over 12 years of experience in health technology assessment, expert in systemic review, vendor and client management, hospital operations, quality improvement projects, developing process specifications by continuous interactions with clients and development team in making health information systems, business process reengineering. She has worked in multiple renowned hospitals like PD Hinduja National Hospital in Mumbai, where she initiated and coordinated hazard analysis and critical control points certification specific to food service department and was also part of NABH team. She also worked in Narayana Hospital, Bangalore and Medanta, the Medicity Hospital, Delhi in operations and acted as a lead for process redesigning and implementation of new ideas for better patient care, mapped ongoing admission, medication, and diagnostic process, identified gaps, and developed system-based process and alerts. She successfully implemented and scaled up processes. She also worked with Government of India, Department of Biotechnology Project and Organization, Kalam Institute of Health Technology in Vishakhapatnam. There, as the lead of HTA division, conducted multiple HTA and medical devices in collaboration with Joanna Briggs Institute, University of Adelaide, Australia, as Joanna Briggs Institute affiliated group, wherein she was appointed as deputy convener for all activities for the association, and Department of Health Research, Ministry of Health and Family Welfare, Government of India, as KIHT is appointed as regional hub by DHR to conduct HTA. With all different exploration and enhancement in work experience and skills, she is now a senior consultant in Acquia, which is multinational pharmaceutical consultancy company leading multiple systemic review or meta-analysis for projects for different pharma products and countries. We are eagerly waiting to hear your words, ma'am. Thank you.
Thank you, everyone. Thank you so much. Thank you, Bhuvna, for introduction. It was quite elaborative. Don't worry about my experience. We all are at same page. Every day is new learning. Okay. Hi, Navya. Navya is my team member.
Hi,
And
Tanushree, and hi, everyone. Good morning.
good morning. She has completed, I think, her pharma, and she has quite a good experience in 3 years. She has learned a lot in HEOR division, and will present you a small overview and brief about HEOR domain. This session is mostly to help you understand which all areas a pharma student can explore its opportunity, and we will just like to bring what we are doing here. And this is also an area for your, if you want to look as an opportunity. So now I'll share my screen. I think you all can see.
Yes, it's visible.
Yeah. Okay, so today we will cover HEOR and overview of that, what is systematic review, and for your understanding, we'll provide few references which you can refer for HEOR and systematic review. So first thing, let's make the session quite interactive. I leave to the organizers and to you guys, if you want to pitch in between, we can come up with the questions, or you want to take everything at the end. This slide is just want to understand from you all first. Maybe I should not show, and let's talk. What do you think that which areas are have understanding which areas pharma students can go as in think of their opportunities in healthcare? Anybody if want to talk? Anyone? Where all you think that you have an idea that this is an area where we can work, or have some idea of those areas?
Research field, ma'am, industrial sectors,
Okay.
pharmacovigilance,
Okay. What else?
Regulatory affairs,
Great. What else?
medical writing,
Nice.
data management,
Sorry.
clinical data management, ma'am.
Okay. I think most of you are Farm D students and Farm students.
Farm D students, ma'am.
pharmacy students, ma'am.
I should appreciate that you all are very much focused on your career, and most of you know where you want to go and what you want to be. Okay, let's go to the slide. I think most of the areas you have covered. So yes, as a PharmD students, you can also go have an opportunity in hospitals. Hospital, if you see, it's a huge setup where direct interaction with the patients are there. And every day in and out, the only thing goes over there, apart from what doctor is there and nurse is there, is the medication. And a big supply chain management is very much required in hospital, which can be very much an area for your where you all can look for as an opportunity. Then definitely pharmaceutical industry, research and development, public health sector. Public health sector is also a big area where government driven policies are there, where you can reach to the last mile people who don't get the services very easily. So what kind of schemes can come up, or which kind of formulary can be used, or different regulatory methods can be used over there? So that is one of the sector where any pharma student can explore the opportunity, and definitely the insurance companies. Okay, any question over here? Can we proceed? Wherever you feel like, we can just stop it and we can have a discussion. So why we wanted to bring this up, just to give an idea that of all these areas, research and development, pharma industry is where we pitch in. Myself and Navya are working in this segment as an HEOR. So I'll take you through what is HEOR, what's the importance of HEOR, and we'll like to give you a bigger picture of an HEOR so that you relate to it, that what is the last outcome of it, and where do you lie in the bigger picture of finally when the drug is given to the population, what is your contribution to it? So as a topic of health economics and outcome research, health economics and outcome itself defines what it means. Health economics means health, any intervention which is given to a population, to patients, how it is the outcome, how it is the aspect of that, and how they are related with the cost and the consequences of any intervention given to the population, how to analyze that. So, a small example for this, don't think that health intervention, just as in broader aspect, health intervention is just not pharma. It can be any intervention given to a patient. It can be medication, medical device, your ventilator, any diagnostic devices is also part of intervention. Any scheme run by a government, any program run by a government, maybe polio eradication or malaria related programs, or programs for pregnant women, any program, any intervention which helps in final outcome of a betterment of a population, of a patient, that is called as health intervention. So anything, whenever an intervention is given to the patients, what will be there, it has to happen that there will be some consequence of that, which is the outcome. And then the second part is always it will be associated with some cost. So that is what we understand in health economics. We want to analyze, is the cost implied for that intervention is more, or the benefit of that intervention is more. So that analysis is done as part of health economics, and outcome research is definitely what you evaluate in the. I think someone is on mute. Yeah. So outcome research is what we evaluate as an outcome of an intervention. It can be based on patient-related clinical outcome, humanistic outcome, and economic outcome. Human patient-related outcome is straightforward outcomes that I'm having a fever, you have given me paracetamol. In how many days did I respond to the paracetamol medicine? Or any oncology patient is given some intervention of chemotherapy, radiation therapy, how much days overall survival increase. So that is direct outcome. Then humanistic outcome is any patients. Suppose today I'm having I'm a oncology patient. I will have certain activities which would have lowered in my daily workday life. I might have developed mental health problem. I would be depressed about my illness. I would be lying on the bed most of the time. I will feel fatigue. So these are patient-driven, patient-related, direct questions which are also a part of an outcomes, which is also part of outcome research. And then finally, the economic outcome, it differs. Economic outcomes, just taking a simple example, every individual have their financial at, at every step, right from your house, you do economic analysis. I'm a patient. Depending on my budget, I will evaluate that. Can I go to a 5-star hospital, which has big services, all kind of fancy services, a good room, everything, or did my budget just constrain me to a public health hospital? So that economic evaluation starts from your house itself. We call it as a societal perspective. And when the government is analyzing it, then they will see, okay, this is my budget for the healthcare department. What kind of diseases are going in the country right now? Which disease I should focus in, and where should I put my money in? So that kind of different evaluations at different outcomes at different scenarios are done as an outcome research. So that's the brief on what we call as health economics and outcome research. Any questions on this as of now? Any understanding? Okay, I'll proceed. So what is the need of HEOR evidence? Basically, we generate evidence here because without evidence, everything is just opinion. So the need of the HEOR evidence helps in identifying the unmet needs. Suppose currently, until we have not analyzed what is there. Suppose I talk about India. If I have not analyzed what is the need in India, the further gap analysis will, until we don't do the gap analysis, will not go further in depth that what is the requirement and how we can give the solution to it. So that is one area where HEOR helps in. Then definitely, as I said, that promote patient-centric research, depending how the patient is. Suppose any chemo or any drug is coming in the market, but adverse events related to that drug is a lot of list of that, then why that drug will come in the market. So our approach will be more that what benefits to the patient as a holistic approach. So as we have already discussed, in patient-centric research, it helps evaluate cost, adapt data to different population. If we belong to lower middle income country, there is developed country, the scenarios are very different, the finances are different, the structure of population is different, the landscape is different. So everything cannot suit everywhere. So that difference, what is the gap there? What can be implemented here in the lower income country? What can be implemented in the developed country? That also differs. So the complete evidence generation, the complete research differs also based on population as well. And definitely any drug coming in, it requires regulatory, it has to go for the regulatory submissions, approvals, so which helps, the HEOR evidence helps in the HTA submission. So I'll move forward. So till here, HEOR is not just restricted for drugs, not restricted to only pharma. It can be broad. Anybody wants to ask any question? There's some background noise. Yeah. So HEOR evidence can be for any kind of intervention, any healthcare intervention which can benefit the outcome of a patient and where the cost is involved. But if I just go, as you all are from pharma backgrounds, let's just focus on how the cycle of a drug goes. So if we see that you all are very much aware about the cycle of drug cycle. So that this is your preclinical cycle, and then phase 1 onwards is where the subject gets involved. So the HEOR evidence, basically this is what we have just listed here, what evidence we use in our evidence synthesis for HEOR come from the phase 1, phase 2, phase 3 studies and onwards. So if you see here, it is written PRO instrument development. PRO instrument development is patient-related outcomes. There is questionnaire which is developed. So there's a list of questions which we make asking the patients that, okay, after getting this medication, are you feeling better? Are you getting diarrhea? Are you getting more fatigue? Or patient can also come up with their own answers. So accordingly, a questionnaire gets developed for them. So these all aspects come from these trials. So this is like global value dosage, budget impact model, cost effectiveness model. These all are part of epidemiological literature review, clinical review. So from where the evidence is coming from your from the drug cycle from phase 1. So this slide is basically talking about the trial cycle, right? From where the trial data comes from. But there are also many evidences which we get from the observational studies, where it's not an experimental, but sometimes some study require association between the drug and the outcome, or different subgroups are there, the association between them, the risk association. So those kind of study also come from the observational studies. there are economic evaluation studies or different studies. So yeah, just to give a scenario to you guys that from where the evidence for when we are talking about HEOR evidence, which is working on the evidence of the different outcomes, from where it comes, from where it gets generated, it generated from the cycle after phase one clinical trials. Okay, so this defines all that what is the importance of HEOR as in bigger picture. We are where we are at evidence review and synthesis stage. As an HEOR expert, as a reviewer, as somebody told that somebody wants to work on medical writing, somebody is going to regulatory. But what they do, if I am as a part of currently in my pharma company, I'm working in evidence generation and I will be working on synthesizing the evidence. After we work on clinical outcome, economic evaluation information, we synthesize them, and then that is presented to a decision maker, where you lies your regulatory bodies who is going to review these synthesis, and then they take final decision. And depending what intervention is being shown for the decision, suppose if you see here in the decision making scenario, that's just not include economic and clinical outcome. It also has listed acceptability, equity. These things differ in different scenarios. So I'll just give you one example. In Indian context, we all know that fetal mortality is very high because of gender issue. Some people don't want female child. It has happened previously also a lot that we here in India, we just don't disclose the gender of a baby. Why? Because we know that the mortality rate is very high. So there was a device which was given, I think it was it was launched by Philips, and it was a handheld small ultrasound device. If you have seen, I don't know how much you have worked in has known about public health sector. So the structure is like, if there is a sub center, then comes a public health PSC, public health system, and then secondary your district hospital and the bigger hospitals. So the sub center is really inside a small village, and not much facilities are given there. And it caters, I think, 5 to 6,000 of population over here. There, the patients who are there in the village to come to the hospital, they have to travel a long distance. So the pregnant women who are there in the villages, it's not very easy for them to travel till the district hospital to get the ultrasound done. So there was a device, which was a handheld device that anybody can go at the doorstep and scan the baby and see if the baby is fine. And then the further treatment can be according to that. But that didn't get accepted in India. Can anybody think why? It was a good device. It would have helped really many mothers in the improvement of the health of their health and the baby's health, or just understanding how the progress is being, but it didn't get approved in India. Just anybody? Okay, I'll give the answer. The reason was because we know that if ultrasound would have been done in the small houses, going deep inside the houses, the mortality of fetus might have increased based on if the gender identification can happen through that. So because of that, it didn't get accepted, and the decision was made that even the intervention was quite cost effective. It would have really helped in clinical outcomes, but still because of the gender equality and issues in India, we didn't went ahead for the decision of including it in the public health system. So these are different scenarios. So this giving you a bigger overall importance of HEOR, that, okay, we help in evidence synthesis and it finally goes for the decision maker. But yes, for decision makers, they have multiple more reasons to make a final decision. But we are part of a bigger picture where we can see that, okay, what we are working today, some part down the line, it might help in some decision making. So these are different HTA bodies across international. In India, we have an HTA body. Mostly HTA in work on medical devices, because our public health system is it's very different. We have to really work on different landscape. The terrain is very difficult because I have been in the public health system and I know that they are kilometers and kilometers deep inside and really nothing reaches to them. So what best they can do, they're working on small glucometer or small point of care devices which can help in early diagnosis of these patients of any kind of disease and help them in better improvement in the life. So yeah, they are different. These are different HTA bodies which work on interventions and how it can and help in regular for final approval of any kind of drug interventions. Anybody, are we not going to talk? Any questions? I'm not clear to anyone? There's no question.
No, ma'am, we are clear. That's why there is no question actually. We're getting all the answers from your lecture.
Okay. Right. Thank you. So let's move ahead. So I'll just brief you. As we have seen, the HEOR includes many departments, many different skill set and different areas. I'll focus on systematic literature review, where we are working in as an expert, myself and Navya. So we work in synthesizing the data and in a many so it's the same thing you would have done literature review. Suppose if you are going for any submission of dissertation or anything, you make an introduction in the starting, right? Introduction is what you do some background check and you write a brief about your background. Okay, 10 studies reported this, or there was epidemiologically data, some disease you are working at. Okay, this patient, the patient is 1:10 ratio, something like that. So that is a small review what you're going to do of just doing Googling. That's called a hand search. It's the same thing but in systematic literature review, just adding a word systematic makes it more methodological. Every step is laid down, every step is clearly defined how it has to be performed. Every data is mentioned that, okay, after I added, suppose I'm working on breast cancer. So if I type breast cancer, they will be around on Google. They will show on the top that 1,000 or maybe 1 lakh papers are there. So in systematic literature review, when I do that, as soon as I write, suppose breast cancer and showing 1 lakh reviews, that also I'm going to note it down. That today I did on 20th 3rd, 2020, I did a review. I started a review. I typed, these are my set topics which I wanted to check. I will make certain questionnaire for it, that this is what I want to study about in breast cancer or in oncology. This is the particular age group I want to look at. Above 18 patients are having oncology. Are they affected by mental health? Something like that. So that kind of question I will prepare. And then when I search or I'll check for some databases, which I'll show further, then what each and every steps, every data points, I'm going to note it down. So that is what is in a nutshell, in a bigger picture, that's what is called systematic literature review. So systematic literature clearly formulated questions that use a systemic and explicit method to identify, select, critically appraise relevant research, collect and analyze the studies, that included in the review. And it does no expert opinion we take. A review of expert opinion is separate, or even in this review, when first thing is evidence generation. You find the evidence, you analyze them, and make it data out of, make a proper analysis of that. And definitely you can include a expert opinion of our experts. Suppose whatever data is going on, but still we have doctors who are very much expert in their area. There's no harm taking opinion of them, but in systematic review is more on what is available, the data, what is available. So a systematic review is a review that attempts to collate all empirical evidence that fits the pre-eligibility criteria in order to answer the specific research questions. So whatever if I want a review to be done, I need to prepare. You would have read few articles till now. You will see that they will write in a paragraph, this was the eligibility criteria of the population which I took in my publication or in my trial. They will write that above 18 years, or they got only first line therapy. Some criteria will be laid down. So even in the review, when you're doing a review, you have to write down properly what you are going to include, what you are going to exclude, and make it you have to get it written before starting a review. So just to give in, what is the benefit of systematic review? There, if you see, even a single study which is being published or being a trial is done, somewhere for a primary study, there will be some biasness. They will write the list of limitation. There will be some hidden biases in any paper, any trial. But what you can do in a review, we can just try to minimize that. We cannot eradicate it completely. Biasness can be everywhere. So systematic review just helps us to reduce these publication bias, language bias, selection bias. So suppose how we think that the biasness, even when we are doing a primary study, we have a hierarchy of study design, right? We have expert opinion. At the end, we feel that a lot of biasness is there. Then comes the observational descriptive study, then comes the observational analytical study, case control study, then cohort study, then non-randomized study, and then RCT. This is also based on the how we move ahead and keep reducing the biasness. What we do in RCTs, we randomly distribute the population in two arms. Why that random distribution is there? So that the biasness while allocating the patients in the two groups doesn't be there. That's why we call RCTs as the best study design, because the amount of biasness usually all the study design have, it get reduced in RCT. And then what is systematic review? It collates all these evidences. So anyways, because it is very methodological, the biasness which is there in these reviews will remain. You cannot completely eradicate it, but you can definitely minimize it. Fine. So these are different study design, different kind of publication which goes in systematic literature review, and systematic reviews and meta-analysis are kept at the top because they analyze every study. Along with analyzing the data or writing the data or systematically taking the information, we also critically appraise each and every paper which we include in our study. We rate them, that is this paper good? The quality of the paper is good depending on the method of that paper. So same thing, a review which only includes a descriptive or an observational study, the quality of the study might not be very good. So in the end, although you have done a review, the conclusion can also be a more better trials or better study design need to be done in this area. because your review itself is based on the studies with the quality of those studies are pretty less, right? So this is like what we do in SLR, how we do conduct our SLR, what is the requirement which you need to see, understand why the SLR are done, benefits of SLR, and which kind of evidences we use in an SLR. So just to give an idea which type of SLRs are happening, SLR and TLR, if you see TLR is called targeted literature review, SLR is systematic literature review. Not much difference. The only difference is TLR becomes more focused, focused in the sense of there's two scenarios. When we do an SLR, mostly suppose a client has a drug, they want to see if they want to see a clinical benefit of that drug. They want to see, okay, if I'm giving this drug to a patient, how long that patient is going to live. Okay, that become your clinical outcome. In that scenario, clinical efficacy point is very critical point for any treatment, any drug, right? So what you want to see, you will not like to miss any evidence of that. In that scenario, we do a systematic literature review. We want it is to be more comprehensive. Two reviewers do this process. Two people were going to review same set of questions, same set of they will screen same set of title abstracts. So there, two reviewers will be throughout the process of this. Where in TLRs, it's a target literature review. The more understanding what required in this is client want to see, they want to launch a product. They might need that, okay, at this is my product. Suppose any leukemia product is there. This is my product. I want to launch in India. What they will like to know, what is the epidemiological rate in India for leukemia patient? What kind of treatments are going on currently in India? For that, you really don't need that. Most of the study is going to report the same thing, right? You need not to, even if one or two study get missed, nothing will happen because you want to make a landscape of it. You want to map what is there, the current scenario in this space, in this disease area in India or anywhere else. So those differentiation is there depending what is your basic question, what is the basic question you want to make out of that research. If your question is related to critical outcome where you are evaluating the clinical outcome and you really going for submission or HTA approvals, then you will be going for SLRs. But when your client is only interested in understanding, okay, I want to launch something or I want to work in this space, so I just want an overview or a mapping of this disease or this treatment pattern, then we will go for the TLR. So which kind of reviews we do? We do prevalence instance review, we do epidemiological review, we do prognostic review, we do burden review. Burden reviews, see HRQL. HRQL is health-related quality of life. Quality of life is, again, as I said, I am a patient. I get, suppose even I'm getting a fever. I'm a patient. You give me paracetamol, but taking paracetamol, I get loose motion. Okay, so I will not be very much happy with paracetamol, even if in one day my fever goes off. But if 4 days I'll just do loose motion, I'll be still upset. That affects my quality of life because still I'm not able to join my office. I'm still bedridden, so it's not at all improving my quality of life. So that comes in quality of life. So that is one kind of review we do. We do effectiveness, like I said, clinical trial, your clinical reviews. You use observational, which kind of studies we use is listed here. And then we do economic evaluation studies also. Economic evaluation studies is like the same, depending, this is a treatment. What is the cost of that treatment? What is the outcome of the treatment, and how that treatment is improving the quality of life with this much amount. So that gives an evaluation of overall outcome, including the economic evaluation aspect in that. So that kind of review we do in our as part of target literature review or systematic literature review. So these are databases. So this is very important to understand. Suppose if I'm doing a clinical review, I want to do a clinical review, I like to go, these are databases. So you would have seen that there are certain journals where different kind of studies, suppose oncology journal is there, you for publishing, you contact certain journals. Journals are different, but there is one, someone who, like a library, like so we have different kind of books, but there is one library which has everything, right? Every type of books will be there in that library. Same thing, there is one databases, these are different databases where you keep all the kind of journal, all the kind of studies at one place. So Embase is one where you get maximum number of studies, different type of publication, different journals are listed in Embase. PubMed is one, Medline. Mostly your clinical, your HRQL databases, your economic, we always search in Embase and Medline. But again, apart from this, you need to also know, suppose we are doing economic evaluation, we should know which database include economic studies more. So EconLit and its EED, these are certain databases which are specific to economic studies. Similarly, so Cochrane Library, mostly this also get your clinical or any kind of studies you come. Psych Info, you will get more your mental health studies. You will have to include this as one of the database where you are going to check for your studies. So when we are doing a review, we just don't blindly go ahead and do. We should have a little understanding which kind of database include which kind of studies. So when you're doing economic evaluation, you should know that EconLit, you have to add it. NHED, you have to add it. When you're doing a mental health study, Alzheimer's study, you should know along with these Embase, Medline, I should also include Psych Info database to see if I'm not missing out on any evidence. So this is called searching for studies, a databases where we look for our evidences, where these are databases which collate all the publications where we check for the studies. This is a process map for the systematic review. So as I said, as I showed last, see if you can see PubMed, Embase, here we search our databases. Before that, we write a protocol. We write down what activities, we make a questionnaire. Okay, this is my question. This is what I want to make a research on. Then I'll write what is the method I'm going to follow. I'm going to, you will write it properly that, okay, it's a TLR, or it's a SLR, it will be a double review process or it will be a single review process. You will write your inclusion, exclusion criteria. So first, before starting a review, first what we will do, we will write a protocol. Then once the protocol is done, then title abstract screening will happen, full text screening will happen, data extraction will happen, and then final analysis and statistical analysis, report writing happen. So this is overall process what we follow in a systematic review. Every step is laid down. What we will do in each step is written here. We have to mention all, import all results on EndNote library, remove title, author, year, 2 ways. Every data, every point will be written. So that even, so systematic literature review said that even after 10 years, somebody wants to reproduce, it will be reproducible because you are going to, when you doing the review, you are writing which date you did. If somebody will put the same date in their research question and run the search, same number of hit will come because it is every step you have mentioned the details carefully. You have noted every detail of it. So any questions still here? Because we are just going to about to end. So just wanted to give you an idea what we do in systematic review. This is the process. What all understanding you should have. You should know about the study design. You should know about little idea about databases, what kind of reviews are there, have an idea of a study design by what helps in systematic review, what it is, and different, and where you basically lie in a bigger picture, what we do and what helps, what from what evidence we do, where it finally helps in.
Hello, ma'am. Good morning, ma'am.
Yes, please.
I have a small doubt. Like when we are reviewing the literature from reputed journals, and if we come across contradictory conclusions from different articles, uh, if both of them belong to some reputed journals, then how can we come to a conclusion like which one is correct?
Not necessarily every review comes to a conclusion. Review is basically synthesizing the evidence. Certainly, there will be 10 papers might say good and 2 papers will say not good. So, what is our work to make a proper? We need not to make a judgment over there, but what as we use certain statistical tools, it also helps. So, one paper is saying not good. You need to see. You might have to evaluate that how much sample size that paper is using. What is the study detail design that paper is using? If the paper is using RCT and a bigger sample size than the other paper, which is an observational study, and saying it's not a good, means it's the sample size is lower, it could be a good paper in itself, being an observational study. It's fine that they have been published in different good reputable journals. Need not to make a conclusion of it. What you have to write in the end that we found only 2 papers out of it, and we feel that more research has to be done in this area. That is also a gap analysis, right? As I said in the starting, HEOR is just not going for the HTA submission or just not one thing. It includes everything. Gap analysis. Okay, only 2 papers are there, and both are talking different things. How anybody can judge it? You need to do more research on this area. That's your analysis. That's your outcome.
Okay, ma'am. Thank you.
So systematic review, in the end, you need just 2 paper or even no paper is there, is also a review where you have reviewed different kind of papers and you have seen that this area is of importance and no good papers are there. That itself is a review. There is no evidence which can help us in improving our patient's outcome. That itself is a review. For meta-analysis, you need 2 papers minimum because at least you are going to analyze something. That's a statistical tool. That's part of systematic review. But don't think that review we need 4 papers or 5 papers or somebody has to say good about it. All 6 papers have to say good about it. Not like that. No review, no papers, good papers is also your review because you have seen all the databases, you didn't find an answer to your research question, which you felt is relevant. So what is your answer is, there is a gap in this area and more research is required. Okay, so that is also a systematic review.
Thank you.
Thank you. So we will come to our almost a conclusion. So what are the areas, if you want to work in HEOR domain, you have to have a good idea about the study design, little idea about your biostat, should have a good, read a lot, read more publications, make an understanding which kind of, how the paper is being led, how different clinical outcomes are there, or economic outcomes are there, or HRQL outcomes are there, different epidemiological reviews are there. Try to read different kinds of review, which will give you an idea what kind of reviews are there across. So these are the topics which you can go through: types of review, basic systematic reviews, meta-analysis, concept of medical statistics, and certain softwares are used. We use while doing reviews. R is used, Cochrane Raven 5.3 you can use. That's really downloadable. If you ever want to do a review or do a meta-analysis, maybe at the final submission if there is some internship, I don't know. So if anything is like that, you can download Ravement 5.3 and conduct a meta-analysis if you want. And also have a good understanding of Microsoft Excel. Most of the work is done in Excel. Even if you know Excel is good enough. Yeah, your economic modeling studies are mostly done on Excel. No software is required. Excel itself is too vast to understand. So this is, we just mentioned that if you are interested, feel interested, working in HUR, have such understanding and explore the area. And these are references freely available, which you can read more. Cochrane Handbook review is there, PubMed to understand the bibliography, ISPER guidelines are there, nice HTA documents are there, which will help you to understand how the HTAs are done, how the reviews are done, the purpose, the need, the importance of different documents. Yeah. So these are, Navya made an effort and listed different HEOR consultancies, companies which are in India, where if you want to work in, and you can explore. Novo Nordisk is direct parent company, your pharmaceutical company, Novartis is pharmaceutical company, IQVIA, we are pharma consultancy company. So these are quite a few list of companies where if you are looking into HEOR, you can work in these areas. Yep. With this, I'll hand over to Navya, and let's see what she has for us to tell what has been her journey and how she like HUR and how she has progressed in this area.
Yeah, thank you so much, Tanushree. And that was very interesting session. I was thinking when I was in my college, why I was not having such clear explanation on SLR and all. But yeah, so can I have your videos on, please, so that I can have, I can interact face to face, because I'm not going to present anything. I'll just speak with you. That's all. To just tell my journey. Like I have also recently started my career into HEOR. So I'm a 2019 PharmD passed out batch. So you can consider me as your super senior also. So can I please have your videos on? Yeah,
Ma'am,
thank you
hi
so
ma'am.
much. Thank
Ma'am,
you.
can I introduce yourself, ma'am?
Sure, sure. Carry on.
Ma'am. Now I'm going to introduce one of the youth icons of PharmD, Dr. Naveshri. Dr. Naveshri has completed her PharmD in 2019 from Talla Padmavati College of Pharmacy, Kakatiya University, Warangal. With lots of passion towards health economics and outcomes research, she searched for opportunities in this domain. By attending different seminars and taking guidance from renowned people in the industry, she could achieve whatever in her thought process. She is having few publications with the support of her team. She is also a student member of the Professional Society for Health Economics and Outcome Research. Initially, she worked for Marksman Healthcare Communication for about 2 years, where she gained basic understanding on the workflow of systematic literature reviews. After that, she got placed as an associate consultant in IQVIA, a multinational pharmaceutical consultancy company. As a part of the literature review team, she is responsible for delivering quality projects on clinical, economic, epidemiology, humanistic burden review. We are eagerly waiting to interact with you, ma'am. Thank you.
Thank you so much for the introduction. So yeah, there is not much, but yeah, actually it the journey started right from my PharmD fourth year. Actually, I am also a PharmD student, so I am very excited to tell you my journey, because when we are in PharmD, we will have a lot of confusion. Oh God, some people will be telling we have good opportunities, and some people will be telling we don't have opportunities. Some people will have some idea to work in the hospital only as a clinical pharmacist, and some few of them will go out of the box and search for the opportunities. So we don't need to worry about anything. So we have plenty of opportunities, as Tanushree was telling in the initial slide. So we have in the hospital sector, industries, pharmaceutical industry sector, in every sector we have a lot of opportunities. The main thing is we need to understand, we need to search it right from our college days itself. So when we are in college, we just study and pass out, because just to pass in our exams, and we just come out, and we are in a hurry to join in a job. whichever is coming first, we just join in that. So but it should not be basically like that. So we attend a lot of sessions, a lot of seminars in our college days. Not only seminars, we have a lot of subject knowledge in our college. So we have to utilize that and try to implement it into other practical situation. Where can I use this knowledge which I gained in my college? So you have to think in that way. So similarly, likewise, I have attended a workshop of SLR and meta-analysis. So right now where I'm working into that only. So that enlightened me so much that I am very much connected to SLRs and meta-analysis. And from my fourth year itself, I was trying to join compulsory into this field only. And from then I tried, apart from the academics, we should also try to learn more about this, so now I'm into SLR and meta-analysis. So I used to try to just learn what is an SLR, what is a meta-analysis, and I used to try to connect the people who are into this stream only, like SLRs and meta-analysis and everything into HEOR. So that they used to give some insights, and I used to take them and I used to work on them. And finally, I used to do some publications kind of thing in my free time in my college, and that really helped me in getting a good job after my before completing my family itself. So that, because how much ever you work for it in the initial stages, that much soon you will be getting into your passionate job. That's not only this out of hospital jobs, you can also get a job into a hospital as a clinical pharmacist with a lot of passion right from your college days itself. So please utilize your this journey, college time, not only in enjoying but also just try to understand which is your interesting topic. Some of them will be having hospital as interesting, some of them will be having PV as interesting field. So you'll be asking always in the LinkedIn, we receive a lot of messages now, I'm really interested in joining into PV, so can you just tell me few opportunities if you have into your company. You just text that all. So before actually having all that, you just know actually what is your interest, real interest, so that you can really gain the knowledge in that, and compulsory your wish will be coming true. Because I believe in that, and I have achieved it, so I'm telling it you very happily. So that's how my journey was. Like there was, yeah, after PharmD I just got into marksman, as she told. So then now I'm into IQ, and I'm very very happy to be here, because I'm learning a lot of a lot of new things which I don't know before. So my colleagues and my peers in this organization really helped me to be here actually. So, and thank you so much, and if you have any type of question you can ask me, because simply attending the webinar and forgetting about it will really not help. Because at least one of the person in the seminar will be connected to this topic, I guess. If you are really connected, just research on it, have some ideas, because it is really related to the family subject knowledge. I really tell that, because you should have the clinical knowledge which is right from a first year to sixth year. You are thorough in the clinical knowledge, and you also have the statistical knowledge in your fourth year. You have the pharmacology knowledge right from your first year. So what else? A clinical research knowledge. You who are all the family fifth years, you'll have the clinical research subject also, and pharmacoepidemiology subject, pharmacoeconomics. So these three are the pillars to join to HEOR. Actually, you to come to HEOR field, these three subjects will really help you, because in the pharmacoeconomics you have the pharmacoeconomic evaluations, and you also have the clinical research, study designs in the clinical research. Everything will be really really helpful. So thank you so much for this opportunity. And yeah, the session is open to questions or doubts, anything.
Yeah, good morning, Navya ma'am.
Yeah, good morning, Yogita.
Firstly, I would like to congratulate for your success. Uh, and also, I have a question. Like you said, like you did a few publications in your college days.
Yes,
Can
yes.
you talk in detail about that?
So basically, when I was doing the ward rounds, and all, when I was in my family fifth year, actually, I did a project. We used to do a project, right? We should do a project in fifth year, right? It's a curriculum for us in the academics. So after doing the project, so our professors in the college, they suggested us to do the publication of it. Initially, we were like not that much aware of how to do a publication, but they conducted the sessions internally, and they make us aware like this is the way to do publication. And one of the each and every team is having a lead, right? Project lead will be there, and that lead used to support us in conducting the project neatly, and applying the analysis part, everything they used to help us. And then what after the completing of project, what we need to do is we have to just prepare a manuscript, and we just need to submit to a journal which is related to the particular topic which you have done the project. So that is very simple. You don't need to worry about how to do a publication. First of all, you need to complete your project work. After your thesis is ready, you just need to make a short gist out of that thesis, and after that you can just check. So I have done a project on HIV. Okay, so I used to search for the journals related to HIV. So I used to search the journals of India and international, national and international journals, and I used to send my manuscript to that journals, and they used to accept it if it is relevant for them, and they used to publish it. So basically in publications also we have free publications and paid publications. If the team is capable, you can go to the paid journals, and if the team is like okay at the student level, we just go for the free publishing journal. So I went for the freely publication journal. So you should compulsory have a guide to do this at the initial stages.
Yes, ma'am. Thank you.
And one more thing, in the ward rounds also, you you attend the ward rounds and you see different cases, right? So while seeing the cases, you can take the similar types of cases and you can publish a case report on, sorry, case series or case report on that. You know what is a case report, no? Which is
Yes,
newly
ma'am.
identified, anything which is newly identified from a patient, any ADR or anything which you have identified for the first time, then you can take it and you can just give a publication and keep it as a case report. So in that way, you'll have a good, it will really add a strength to your profile. Trust me, that will add you value.
Yeah, ma'am. Thank you.
Until now, what Tanushree was telling regarding SLR and meta-analysis. So this part also in your 50th year project, you can use this systematic literature review of any topic, and you can just do an SLR for that particular topic, which in which you are interested. So that also you can publish it. That will really help, be helpful. That is also an idea. You can do this also if you are not interested in the war rounds. You can just Google by whatever Tanushri was showed just now. Different databases are available, freely available databases. You can go there. You can do SLR neatly with your team support. So any
Hello,
more?
Nagishri ma'am and Tanushree ma'am.
Yeah, hi, Nirosha.
Yeah, ma'am. Actually, so thank you both of you for explaining this very wonderfully. And I wanted to ask, like, as a fresher, as a PharmD fresher, how can we approach to the companies for this HEOR posts, and how can we apply, and how can we know about that? I wanted to know about that. So it will be really helpful if you say about
Uh,
that.
so Tanushri, will you tell? I'll just tell my experience, but it is very common with all the students. After completing our course, we just apply for a few companies, and one or the other company will take their resume and they just call back. If our profile is good, they'll be calling back, or else we don't get a call. That is very common with all the students. So you'll be the better person to tell more out of your experience.
See, for a fresher, it's difficult, but not very difficult. Some companies require fresher at some point of that time because that's the major base which any company can have, and most of the companies help in training also. So we have what you need to do is first see if you are interested in HER. Just Google it. You will have list of companies which are there in this domain. Make your profile in LinkedIn. Explore there because you get to see a lot of be very active. Do daily check what are new companies coming in HER, what is going on, and in LinkedIn also you can directly apply. Otherwise, just check job opportunities in HER, and you can apply through that. And also, many of the companies come to the colleges for the recruitment. If your college does, then through that also you will get an opportunity to be part of this.
Yeah, okay, ma'am.
But be very serious in application. Just once, don't call. Just sending one's resume and forgetting about it will not really help. We just need to be back of it. You just showcase yourself. What are the skills you are having? The people should know, right? So just showcase yourself, learn more. Just be unique from other people so that you'll be selected easily. That is the only suggestion I can give.
Yeah,
That
can you could
See, just don't be worried about being unique. Be consistent. What you're working, do a hard work. Not necessarily everybody is only a topper of any college or a unique person can only get job. Don't be worried on that. If what what is required along with technical skills is your behavioral skill. Are you consistent in your work? Are you sincere enough your work? Are you passionate about your work? Are you open to learn something new? How well you are within the team? Are you listening to your the feedbacks given to your even in the college if any teacher tells you you have to work in this area? How positively are you taking that feedback? So just don't worry that okay I have to work things we learn on the way also, but inculcate that motivation within yourself that you want to achieve something. Being an average student or below average student doesn't stop your growth anywhere. Anytime any interest can be developed in anyone, but you should understand what is your interest in. Nobody is perfect in anything. I'm good at something, you can be good at anything else. So you need to understand what are you good in and you want to really work on that area. Be passionate about your work and consistent, truthful to yourself. That is also very important.
Very true.
yeah, you're absolutely right.
Hmm. Eat, sleep, and drink your
And thank you
passion.
for your
That's all.
answers.
Okay. So, any more?
Good morning, ma'am. I just want to thank you both because it was really great listening to both of you, ma'am. And you both explained us very patiently with good examples for better understanding. Earlier, I didn't have a clear idea about health economics and outcome research, its importance, CLR, SLR, classifying the questions and study types according to them, how to search, and a lot more. This is very useful for us, ma'am. Apart from all this knowledge, your talk motivated me a lot. Thanks a lot, ma'am. It was really great listening to both of you.
Thank you.
Thank you. And if your college wants us to give a brief on further brief on systematic review, more details, we are happy to do that.
Yes, we are really happy to share the knowledge because right from your college days, if you are inculcated with all this knowledge, it will be really helpful for you.
So good morning, ma'am.
Good morning.
Ma'am, I have a question. Like after getting to the HEOR, do they have any job positions like stages after getting to it, like promotions or the stages of the job positions?
Every organization will have promotions. First, get into the promotions and all comes all your way. Nobody is going to stop your promotion if you are consistent in your work and passionate about your work. So don't worry on that. That's a far way to come. First, understand what is your passion and where you want to work first.
Ma'am, what is the initial stage of the job and the highest stage of the job in this HEOR?
In the sense, initial stage, highest stage.
HEOR, like after like initially joining the job in the HEOR, the first stage the company will require the student.
We start with analyst, where mostly you will get the training also about HUR. You will be taught about what is how to do title abstract training, full text training. So that goes, and then you further associate consultant, senior consultant, engagement managers, uh, further you go up, your profile changes to just doing technical stuff. So you have to do team building, and further it goes into getting more business for the company or for your domain. So yeah, that's the progress we do.
Ma'am, can you also
So
differentiate the
basically,
HEOR in the national and international?
Sorry.
Can you differentiate the HEOR in India or in the nation or international?
There's no difference. The project profile is same. You have different areas. You work for different companies. Is somewhere you will be working for pharma, somewhere you will be working for consultancy, or you can work for HTA bodies. You can go for nice body or any other. In India, you can work for HTIN, which is a body, HTA body, where they will review the HUR, what any company will be submitting to them. So you can work in different areas, in different organizations.
Okay, ma'am. I understand like the level of getting into the job in India. Is it same for the abroad? Like, do we need to have experience in their appropriate country, or do we have to do any masters, or we get directly job?
You need to get masters in, I think, in health economics. In outside India, there are courses on that. However, in India, not very well established courses there, but outside India, you have courses for health economics and outcome research, so you can pursue that. And you should have a basic understanding of research background, or your as you're a pharm student. I think that is good enough. Otherwise, masters, definitely, if you can go ahead for masters in economic evaluation, you can in health economics, it should be good for international exposure. And PhD is also one of the area which you can look at.
Good morning, ma'am.
Yeah.
Ma'am, if I explore my interest, then do I need to have any specializations for applying for a job in interest areas, ma'am? Is only family is okay, or do I need to have any specializations?
No, no, farm day is good enough. Just read more about HUR, or which area you, because HUR also include different domains. As we showed, some part will be for economic evaluation, some will be for systematic review, some will be for medical writing. So explore, read more about this area, and then you can see that where you want to be. You can be part of systematic review. Need not to, as a fresher, you need not to, I will not expect that you come with full-fledged that day one I will ask you to do a systematic review for me. We will certainly give you a training, but that little understanding should be there, that what is study design or what is the review itself. Just that much is okay, and then yeah, you should be passionate about your work. You
Thank you,
should,
Yeah,
ma'am.
yeah, family knowledge is very much sufficient.
Okay, ma'am. Thank you, ma'am.
Hmm. And Tanushree, actually, there is a question in the chat box. So, if we are ending with a zero review, I mean, a review article with zero reviews, then what about the evidence of that review? What is the next stage?
so that review itself is giving you an evidence that there is no good research done in this area. So that is your conclusions, and you are going to present it that more research in this area has to be done. So
Okay,
that is the outcome of your review.
all right.
That itself is an evidence that no research is in this area. You need to work on this area. That's a fruit for a thought for every new people want to do research in different areas, right? So we need to give them what is a gap right now. So that also comes from our review, right?
So, I guess Amruta got answer, I guess, right? Amruta Kati Sama.
I think this question she must have asked before when I was in already explained.
Okay.
So good
Ma'am,
morning.
if a student is working in India in the HEOR after after getting the experience here, can the person can transfer to other country directly
Yes,
from
you
the
can be
country?
transferred. You can be transferred if you are depending how your progress has been, and the within the organization transfer happens. But then different wherever you want to locate, they will also interview you. If you fall in their criteria, then they will take you. We have such promotion in our organization also. There, so it happens.
Okay, ma'am. Thank you.
And I see a lot of questions, Tanu, in the box, like chat box. They're asking, like, most of the students are really worried about the packages, I guess. So you should never worry about the package, truly. When we were joining into a job, we never thought of salary first thing. We just thought how to enter into our dream job. That was only in our mind at that time. So the salary should not be a concern, because once you are into that position, your passionate dream job, then automatically salary will be coming back of you. Many people have told to me this thing when I was a student, and many of the professors and all told to me that when you are having skills with you, salary, not money, will be automatically following you. That's all. You don't need to be back of money always. Right, Natanu? I believe it.
Right. Just follow your passion, and yes, IQVIA job, you can, there is a portal job IQVIA, you can just check on Google, and you can look for HEOR openings and you can apply.
So it was nice listening to you, ma'am. It's very informative session. And my question is for Navyasri, ma'am. Where you told that you have done some publications in your graduation, like fifth year, and how it differs from writing an article in our Google page. Like, it doesn't need like a publication should need guidance, or else we can do it independently, like writing an article in our Google page. How it differs from a publication.
So you can do individual also. I guidance in the sense, basically publishing a research work is different, and publishing a review article, normal review article, will be different. I mean, but behind the research work, you have to do some kind of analysis and all. So, but in review article kind of thing, you just collect the data and just write the literature with your own knowledge, writing skills. That is different. So for research work, I just told that you need guidance from your peers, so that they'll be suggesting you to do a manuscript and all. So you said some Google page and all, no, that you'll be writing by your own writing skills, I guess, right, Tanu? It will be some kind of writing a review article kind of, that will be very, it is our own thing, way of writing.
You can do, you should write. That helps, because as if that gives you a confidence when you are taking your own research and you want to publish that public, putting it into a public domain itself shows that you have confidence in what research you have done and what you want to write. Everything, it's difficult to get publication done, it takes time, I can understand. Meanwhile, if you want to just post something, that's what I said, go to LinkedIn, post what you want to, and explore things. You can always write, and it will definitely help boosting your confidence.
Yes, ma'am. Thank you very much.
Until and unless you write, your writing skills will not be improved, I guess. Yeah, if we stop writing, then we will be stuck at some place in writing part mainly. So just try to write of your own. Read plenty of articles so that you'll understand how to write, how the data has been represented in the papers. You'll get idea from those.
Yes, ma'am. Thank you. Thank you.
I think we are ahead of time.
Yeah.
And
Yes, ma'am.
Yes.
Yes. So thanks a lot, ma'am, for sparing your time, both of you. Actually, like you spared extra time. So I know it's hard